Today I'm going to talk to you about my lower back pain. I'll tell you about when it started and my journey along the way, things that have helped me and things that have caused me more pain. And I'll tell you where I'm going, tell you what my plans are for the future. So actually, as far as I can remember, my pain went back to the later years in undergrad. I maybe had some pain sitting. The first thing I noticed was I was having issues finding a comfortable chair. I was in denial that I had back pain. I thought it was the fact that chair manufacturers couldn't make high quality cushions. My pain at that time was centered in my low back. I wanted that support, a nice cushy support in my low back. I kept blaming chairs and wondering why people weren't complaining as much. And this continued in grad school. I bought a ridiculously expensive chair, and I even bought an office chair to use at school while I was doing my research. And it was not a good chair. Even my expensive chair was not good enough. There was one incident where a friend invited me to do a sprinting workout. I had done sprinting workouts before in undergrad, but I had not done them in a long time. And we did 100-meter sprints down this field at UT Austin, where I was doing my biochem PhD. I remember we did like 4 or 5 reps, and then at the end of one of the later reps, I just felt a huge tightening of my glute right at the very end, and I couldn't do anymore. That was it. I totally cramped my glute. And that pain went away. I didn't really notice any issues after that, but I had a similar injury that had a much longer term consequence. And this happened in the gym at UT. I was doing a straight leg deadlift, and I was doing high weight, low rep sets. And for this set, I decided, I think I can put 45-pound plates on the end of this bar and do a Romanian deadlift. A Romanian deadlift is a deadlift with straight legs. And I did like 2 or 3 of them successfully, and then it was either the 4th or 5th one. Actually, I think I completed all 5, but immediately as I set it down, I felt this pain in my hamstring and glute, and I didn't do any more that day. I was sore for at least a week, probably 2 weeks, but that soreness subsided. But then I started to feel this nerve pain through my glute and actually through my hamstring. And I started to feel sensation that went all the way down my leg, which was new. It was unsettling because it was nothing that I had ever felt before, and it didn't feel normal. So it was probably around 2014. And it was mostly on my right side, but I did feel the same pain on my left side, just less severe. The crazy thing is that it doesn't feel like a spinal injury. I don't even know if the lower back pain and the sciatica are related. It could be 2 separate issues. But now I had pain in my glute and my hamstring and my low back. And as I was noticing when I was doing long runs with a couple guys that I met in Texas, who are actual ultra marathon distance runners, they were pushing me and we were doing 10-mile runs, which I was used to. But now when I was doing the 10-mile runs, I was getting pain the next day and the next 5 days after the run. So I started to do something about it. I went to physical therapy and consistently did their recommended exercises, including clamshells, which was one that I ended up doing when I did physical therapy here in California, and I'll talk about that. But in Texas, there was no real significant improvement. I was looking at my Amazon orders from that time, and I ordered a racquetball. I remember the therapist told me to use a racquetball on my low spine to, I don't know, loosen it up. And I also bought a foam roller. These are things that I've used as a runner to help with soreness. Around that time, I bought a book that claimed it would solve my back pain. The method that they used in the book was called the McKenzie method. It didn't relieve my pain after about a month or so. McKenzie method, it relies on one main exercise, which is a back extension, something that people tell you never to do, which is to extend your back. Basically, you're lying on the ground and you push off the ground like this and extend your back as you push up, kind of like a push-up, but you don't bring your hips up with you. When I came back to San Diego, I ignored my pain for a few years. And at this point, I'd had consistent pain for about 5 years. But it's not so severe that I can't do my normal activities. It mainly just gives me some dull discomfort that is consistent throughout the day, and it keeps me shifting and always looking for a more comfortable position. But also, I don't want to live like this. I don't want this to become normal. I don't want to accept living with dull pain constantly every day. So I told my doctor in about 2021 about my pain. He recommended getting an MRI and he recommended physical therapy. So the MRI, I think, gave me a lot of information that was never used for treatment. But the documented reason for me getting MRI was lumbargo, which means low back pain with sciatica on my right side. I actually did not get these images. I've never seen these images. I'm just getting the doctor's interpretation of what he saw. So they saw nothing abnormal about my paraspinal muscles, which run up and down my spine vertically. They saw no issues with my spine itself, the vertebrae, the spinal cord, and what is called the cauda equina, which is a collection of nerves at the end of the spinal cord. All of these nerves had a normal diameter and caliber, a normal contour, and somehow they measured the signal intensity. I don't know how. But they did find a small cyst on the S2 nerve root. It's the second from lowest nerve coming out of the sacrum that merges into the sciatic nerve. It's called a Tarlov cyst, and it's filled with cerebral spinal fluid. And it's fairly common. Between 4 and 9% of the population have them, but often they're asymptomatic. But when they are symptomatic, they're often misdiagnosed as a herniated disc. And in all of my research, herniated disc and a bulged disc are likely causes of my pain. But what if it's a Tarlov cyst? Unfortunately, they didn't say which side of the spine the cyst was. If it was on the right side, that might give me more confidence that that is the main issue that has been causing my pain in my glute and my hamstring. They're actually spinal root fibers that can be in the wall of the cyst or even inside of the cyst. An increase of pressure on the cyst could cause nerve pain. There are different options for surgery for the Tarlov cyst that I might need to look into if this is in fact a possibility. My stance on surgery is that I think it would be worthwhile if there was a guarantee that I would come out pain-free, but often the cause of the pain has not been pinpointed, or is difficult to pinpoint. So the surgery can be unsuccessful, or the same issue can return with a resurgence of the same condition. They looked at the lower half of my spine from the L1 vertebrae all the way down to the sacrum. There was no abnormality in the discs from L1 down to L5, but in that last disc between L5 and S1, There were a lot of issues. For starters, there was a 3 mm retrolisthesis, which is when a vertebrae shifts backwards underneath a disc. Basically, my sacrum is 3 mm displaced from the next vertebrae laterally. And then there's a mild disc degeneration on that disc with a 3 mm diffuse disc bulge, which means that the bulge it's getting extruded out between the vertebrae. Just like if I were to press Play-Doh between my hands, it would squish out on both sides. Also, there is a small right foraminal annular fissure. So the foraminal means that it's a hole that allows a nerve root to come from the spinal cord and to either go to my sciatic nerve or to go somewhere else. But it's a little hole that allows the nerve to pass through. And so there is a disc right next to that hole, and right on that section of the disc near the foraminal hole, there is a tear in the annulus fibrosus. So we've put together the full term. There's that outer layer of the disc is actually pretty tough, and once it tears, it can worsen. It can tear further to the point where the soft inside that will come through once it gets squeezed enough, and that is called a herniated disc. But just the tear in the disc is really common. These tears are super common. Up to 50% of the population has annular fissures, depending on what you call an annular fissure. But they're very common, and they're often asymptomatic, and they're discovered accidentally. So we don't know if this is an accidental finding of an asymptomatic fissure, but it is on my right side. So it does lead me to think that it's a plausible cause for my pain. And in fact, annular fissures can cause pain. There's a paper that I found that reports that granulation tissue can form near the annular tissue. This can cause pain, but also there are nerve endings that can grow and cause pain near an annular fissure. But sometimes the tear itself can irritate a nerve and can cause pain wherever the nerve is going. Another thing that's wrong with my L5-S1 disc is that there is some mild facet arthropathy. The facet is where the spine hinges. It is basically the joint of the spine. Arthropathy means a form of arthritis, and I assume they mean osteoarthritis. There are actually lots of forms of arthritis, but I think this is the most sensible type because it has to do with bone and it has to do with a mechanical stress. And since this does seem to be a likely place of mechanical stress as opposed to rheumatoid arthritis, which is normally seen in older people and is a result of inflammation that would likely affect the entire body. So there is some osteoarthritis in that last vertebrae hinge point, which means that there is some breakdown of the cartilage there at the facet and potentially the underlying bone. Although previously the report had said there were no fractures or stress fractures of the bone or bone growth. In addition, the last thing that was wrong with my L5-S1 joint is a mild left foraminal stenosis, which means a pinch of the nerve coming from the spinal cord, created potentially by the bulging disc, but probably not a bone growth. They're saying that there is no significant central or right foraminal stenosis, which means there's not a pinched nerve on the right side or central part of my spine, which kind of goes against the idea that that annular fissure is pressing against my nerve. So overall, their overall conclusion was that there's a minor left foraminal stenosis at my L5-S1, which does not seem to agree with the location of my pain. So these are all my interpretations of this MRI that I'm finally now taking the time to look at in depth. But at the time of the MRI, I kind of left the interpretation up to my doctor and to the physical therapist. But when I showed up to the physical therapy office, they told me that they did not need to see the MRI, which was a little disconcerting, especially with my already failed experience with physical therapists. I really wanted the MRI to help guide them in their diagnosis and their plan for my treatment. But they told me they didn't need to see the MRI because they had little confidence that the images would point them to what was causing my pain. The physical therapist gave me exercises. I diligently carried them out at home, and at first the pain actually got worse. Making the pain worse was actually an accomplishment. If I can make it respond in one way, then I can perhaps change my behavior in the other direction and relieve the pain. So the breakthrough was I was trying to sit in a proper posture all day long, and this was causing me increased pain. And I think I made this connection on my own, or at least thought it might be true, that my posture was causing pain. And I told my therapist this, and she encouraged me to sit in different positions. So I could sit in the proper position like I am now, but it's okay to sit in a reclined position, and it's okay to sit in a position leaning forwards. And I found that this alternating between different positions gave me big relief in pain. Since grad school, I'd been the king of the lowrider. This was the most comfortable position for me. But with this physical therapy, I learned to use a pillow to cradle my back and make that position even more comfortable. But eventually the pain does come back in whatever position I'm in, even with the pillow. So I often shift positions. I'll be leaning in one direction with the pillow. Standing up can provide some short-term relief, but prolonged periods tend to be worse because I can't change my position while I'm standing to a position that better supports my low back. After a certain amount of time of sitting, probably like 3 or 4 hours, there's nothing more I can do. I have to get up and walk around. I'm lucky at my company. I can get up, walk around in lab, do experiments, talk to people. There's plenty to do on my feet. Last August, I actually broke my collarbone skateboarding and had to go back to physical therapy. And I had remarkable success. Over 3 months, I got from barely being able to move my arm to almost full strength. And so there is a huge benefit to doing physical therapy for certain exercises. In my experience, acute injuries, but this chronic low-term back pain has been really resistant to physical therapy. But I like to be super open-minded about treatments for my back, so I tried a few alternative treatments. First one was the Egoscue method, and the Egoscue method was recommended by my uncle John, and he was the one who gave me the book Pain Free. And I read that book, did the exercises, and actually found some relief after a week or so, or maybe it was more than a week. But the pain slowly crept back, and the exercises took a significant amount of my day, over half an hour, and even longer sessions were required when the pain was resurfacing. I contemplated going to their local clinic that my uncle goes to, but my insurance didn't cover it, and the price didn't seem the risk of the therapy not working. Although now that I'm rethinking about it, giving it a try for several weeks would not be a bad idea. The craziest thing that I have tried to help heal my back pain is a 100% mental approach to healing back pain. Sounds crazy, but there have been a significant number of people who have had success with this method, but it didn't work for me within a month. The idea is that the pain, that lower back pain, is all in your head. And this type of pain is termed tension myositis syndrome. And this was termed by John Sarno. He wrote this book called Healing Back Pain that I read, actually when my collarbone was healing. The idea is that your back pain is a result of your repressed emotions that you don't want to face. So the brain creates a distraction. Your brain thinks that something is wrong with your body. It seemed mildly plausible to me, given the little I know about the brain. So I decided to give it my own personal test. I did what the book instructed. I stayed active. I told myself that it's all mental, and to feel my stress and anger and lean into it and figure out what is causing this stress and anger. I loved the empowering feeling I got. I got to feel that I was really facing the tough things in my life, and that I was able to overcome physical barriers with my mind. It was an incredible feeling. And for a week, I thought it was working. I felt so good about myself, and my back felt good. However, the pain remained the following weeks, and I started to wonder what I was doing wrong. I started to doubt my ability to tell myself that it was all in my head. After 2 or 3 weeks, I decided, or maybe it was 4 weeks, I decided that it was too much of a mind game, that I couldn't prove, and I could probably never win. The pain that I have sitting is mostly in my back, but it does reach into my glute and my hamstring on my right side mostly. The sensation down my legs have lessened since the years that I've moved from Texas. There are a number of things that could have contributed to this pain. It could be aging, poor posture. I never had great posture. You're seeing me sit like this, but this is a very rare occurrence if you look at the span of my life. Being tall is a risk for low back injury. All my years of running has a lot of impact on my spine. And also the weightlifting injury and other physical stresses that I've had in my low back over my life. My plan going forward, now that my collarbone's healed, is I'm going to call up my primary care doctor, who had actually referred me to a spine specialist at a place called Spine Zone in San Diego. I made an appointment right before I broke my collarbone and had to cancel it. So it'd be great to make that appointment again. And this doctor also said that I would need to redo the MRI. So I'll probably get another MRI. I don't expect the result to change much, but I will be more persistent in getting an interpretation and a treatment plan from the imaging results, because I feel that there is some information that can be used. Because it makes sense to me that perhaps it is very tricky to find the source of the pain, but I'm not one to give up easily, and I'll continue to look for answers. I'd like to get in touch with a neurosurgeon who can have a better idea of what is causing pain based on the MRI. He might have a better understanding of how likely a certain issue in the images translates to pain. I'm currently lifting weights, although I'm going light with the deadlifts and with the squats. I don't think my pain is severe enough for surgery, but if there is a certain diagnosis, I will consider it. There are a few common surgeries that are performed for sciatica patients. One is a laminectomy, which is a removal of the bone that surrounds the spinal cord near the foraminal hole for the nerve root. There's another similar surgery called a foraminotomy, and this is a removal of some of the bone, but not so much of the bone as to take a slice out of the circular vertebrae. It's a smaller piece of the bone to create more space for the nerves and the spine disc. Another surgery that's done is the spinal fusion that prevents bending and locks two vertebrae in place so that there's no bending of the spine. Thanks for coming with me on my journey thus far with my lower back pain. I will hopefully give you updates maybe later this year. Thanks for listening. Don't forget to subscribe. See you next time.